Welcome and thank you for joining us today. This presentation aims to help you understand myocardial infarction, commonly known as a heart attack, its causes, symptoms, risk factors, diagnosis, treatment, and prevention. The heart is responsible for constantly pumping blood to the body organs to deliver nutrients and oxygen. Blood supply to the heart occurs via the coronary vessels. Myocardial infarction is a medical term used to describe the death of heart muscle tissue due to a lack of blood flow to the heart. Impaired blood flow to the heart can be due to blockage or narrowing of the coronary arteries from buildup of plaque within the arteries, known as atherosclerosis. Blood clot can occlude coronary arteries, causing decreased perfusion of the heart. Spasm of the coronary vessels can also cause impaired blood flow to the heart. If not promptly treated, myocardial infarction could lead to abnormal electrical activity of the heart, rupture of the walls of the heart failure with loss of blood flow to major organs such as the brain, kidneys, liver and bowel. Poor perfusion of major organs could lead to death within a short period. Risk factors for myocardial infarction include age above 45 years for men and age above 55 years for women, smoking, diabetes, hypertension, increased blood levels of cholesterol and LDL that contribute to plaque formation, obesity, sedentary lifestyle, and family history of premature coronary artery disease. Symptoms of myocardial infarction include chest pain or discomfort described as dull or squeezing pain in the chest that may radiate to the arms, jaw, or back. Shortness of breath, sweating, nausea or vomiting as well as fatigue or feeling of unusual tiredness or exhaustion. Electrocardiogram, also known as ECG, should be performed to identify abnormal electrical activity of the heart. Blood test should be performed to determine the level of cardiac biomarker. Serum level of cardiac biomarkers such as high-sensitivity troponin is elevated. Echocardiogram can be performed for visual assessment of cardiac structures such as cardiac walls, cardiac chambers, and heart valves. Nitroglycerin and morphine can help to relieve chest discomfort. Antiplatelet agents such as aspirin, beta blockers such as metoprolol, and anticoagulants such as heparin drip and enoxaparin are typically administered to improve blood flow to the heart. Those who are allergic to aspirin can be given alternative antiplatelet agents such as clopidogrel. Cardiac catheterization can help to visualize occluded coronary vessels. Procedures such as angioplasty or placement of stent can be performed to improve coronary blood flow in the affected coronary vessels. A surgical procedure called coronary artery bypass grafting might be necessary to bypass blocked coronary arteries, using blood vessels from other parts of the body in those with severe or extensive coronary artery disease. Cardiac rehabilitation entails exercise programs, lifestyle modifications, and education to improve cardiac health. Taking prescribed medications as directed and emotional support to cope with the emotional impact of heart attack are also crucial for cardiac recovery. Myocardial infarction can be prevented through lifestyle modifications such as eating a heart-healthy diet, regular exercise, weight management, and smoking cessation. Blood pressure should be checked regularly. Antihypertensive medications should be used as directed to achieve optimal blood pressure control. Blood sugar levels should be checked regularly. Compliance with anti-diabetes regimen is necessary to achieve optimal glucose control. Medications for treating high cholesterol and lipid levels are necessary to improve blood flow through the coronary vessels. Stress management techniques like meditation, relaxation exercises, and hobbies could be beneficial.